And so I hope that you are as interested as I am on the game-changing event that is the availability of these vaccines. And so I'm pleased to announce Amanda Bustamante, who I believe's current title is Outreach Special or COVID-19 Outreach Specialist. Welcome, Amanda.
And Hi, everyone. Thank you for having me today. I'm really excited to talk with you guys. I hope everyone's having a good day, first and foremost. And I just want to say there are a couple of familiar faces. I think I saw Anne on here. I went to school with Parker my entire life, so I just want to say hi. um, but yeah, so we'll just go ahead and jump right in. My focus today is just going to be some of the myths that we're dealing with and trying to combat here when it comes to the vaccines, the efforts that we're taking at Cedric County, and how you guys can maybe play a role in that if you're interested in. So we'll get started. So I am the COVID-19 outreach specialist here at the health department. And now that there is a vaccine, I am the point of contact for vaccine messaging. And so what I kind of do day to day is I work with community partners, and I just help educate them on COVID-19 and safety precautions that they can be taking, any local, state, federal guidelines that apply to them. And we just work together to try to help slow the spread of COVID-19 in our community. And as the vaccine messaging point of contact, it's my responsibility to ensure all the information that we are pushing out, both internally and externally, whether that's with my team, we're making, a new FAQ to put on the website, or if it's, externally, like what I'm doing right now with you guys. It's my responsibility to make sure that all that information is as relevant and accurate as possible. If there's anything we learned with COVID, it's that the information is constantly evolving. And so I just think it's important that we take that same approach of flexibility that we have with COVID, and apply that to the vaccines as well. So my purpose today is just to provide you guys with the facts. There is so much information out there in regards to these COVID-19 vaccines. And with that comes a lot of assumptions and opinions. So my goal today is to just try to eliminate all that excess noise and just give you factual information that may ease some concerns you have or answer any questions you have. And all the information that I will go over today will be coming from organizations like the CDC, the World Health Organization, Kansas Department of Health and Environment, and so on. And these are the same exact organizations that we here at the health department receive and follow guidance from. So, the first thing that I want to go over is the science behind the vaccines and their timely development period. The COVID-19 vaccines are mRNA vaccines, also known as messenger RNA vaccines. And these vaccines are a new type of vaccine that protects against infectious diseases. But while I say new, I really want to reinforce the idea that they are not unknown. Researchers have been working with mRNA vaccines for decades now. So I hear a lot, or we hear a lot here at the health department about, oh, this vaccine can't be trusted. They were made just slightly too quick, things like that. That's actually very misleading because these vaccines will go more into how they work, but they use a framework and then they apply it to a specific infectious disease. So the idea that they were made in just the time of this pandemic is false. They've been working on these vaccines for actually decades. Um, so, mRNA vaccines have several benefits compared to other types of vaccines. And I think the biggest one and the one that eases people's mind the most and addresses the most concern is the fact that these vaccines are not made with they're made with non infectious elements, meaning these vaccines are not putting a weakened germ or an active germ into your body like other vaccines do. mRNA vaccines instead teach our cells how to create a protein or even just a piece of a protein. And then that protein gives our body instructions and triggers an immune response. So it looks something like this. and this may be a simplified version, but typically to trigger an immune response, vaccines will put the weakened or inactive germ into our bodies, but not here. So instead, we get the vaccine and then it gives our body instructions for our cells to create a spike protein. The spike protein that it is asking us to create is found on the surface of the coronavirus. So it's only asking us to mimic it. It's not giving us that spike protein. So our bodies then create this spike protein. And then our bodies recognize that it doesn't belong there. It has some unhealthy behaviors, kind of sketchy, so we need to build up a defense towards it. So that triggers the immune response, which creates antibodies. And those antibodies that build the defense to fight that spike protein that your body has just created is what protects you in the future if the real virus ever enters your bodies. So this vaccine is saying, create this. It'll acknowledge it as not being safe. Your body will then fight it. And in the future, if the real virus ever comes into your body, it then knows how to protect you. So that is mRNA vaccines. So because there was already this framework of decades long worth of work, as soon as the necessary information became available about the virus that causes COVID-19, scientists began designing the mRNA vaccine instructions for our cells specific to the coronavirus. So another major factor why this vaccine was able to come about so quickly is just the plain fact that we had all the brightest scientists in the entire world dedicated to this one problem, focusing on this one virus. And we also had excess amounts of money being poured into this problem. So the idea that so it's actually very reasonable that they were able to create an mRNA vaccine specific to COVID-19 so fast, but really they created it within decades worth of time. So that's the first myth. Next, I just want to go over the vaccines that are currently available. And the two current vaccines, which received emergency use authorization in December, and really quick, emergency use authorization, or EUA as it's commonly referred to, typically happens in a public emergency when there's an urgent need for products or um, to help treat a disease or help prevent medical threat. In these type of emergencies, the FDA can issue an EUA to provide more timely access to products that may help. And there's more information on the specifics of EUA and what that process looks like on the CDC and the FDA's website. I know that when this whole process started, I found a really great video on the CDC that broke it down for me really quick, 2 minutes and 30-second crash course on EUAs. So that's out there if anyone's interested. So we'll just jump into Pfizer, which was the first to be granted emergency use authorization, and that took place on December 11th. And Pfizer is a 2-dose series. It's administered 21 to 28 days apart, and the doses must come from the same manufacturer, meaning if your first dose is Pfizer, your second dose has to be Pfizer. Some specifics about Pfizer: it requires ultra cold storage. There may be some side effects, typically lasts a couple days, wear off. Again, we're asking your body to create a protein that exists on the coronavirus. So naturally, it's going to try to have some wear and tear on your body, but you now have those antibodies to protect you. So they will leave. Pfizer has a 52% effective rate after the first dose, but it has a 95% effective rate after the second, meaning you are not fully vaccinated until you've received both doses. The Pfizer vaccine is currently being distributed by the KDHE to local hospitals for dispensing to frontline healthcare workers, and then by CVS and Walgreens to long-term care facilities. And that was arranged by state and federal government. So Moderna is the next vaccine. It was granted emergency use authorization a week later, and it is also a 2-dose series administered 28 days apart. And just like Pfizer, if you start with the Moderna vaccine, you need to finish with the Moderna vaccine. There are a lot of questions about how do we know which one? How do we make sure we're going to get the correct second dose? Every vaccine kit comes with a CDC immunization record card. And when you go and get your COVID-19 vaccine, the person administering your vaccine will fill out that card and write, Moderna, lot number, all the specifics so that when you go in for your second vaccination, there should be no confusion on which vaccine you need. But some specifics about Moderna, this one requires just cold storage, where Pfizer requires ultra cold. Again, with Moderna, maybe side effects, go away in a few days. Moderna has a 94.1% effective rate after the second dose. Same situation, you're not considered fully vaccinated till that second dose. And Moderna is actually the one that the Cedric County Health Department is administering at our clinic. And that is for no specific reason at all. Pfizer has a little bit of more challenging with the storage because it does require ultra cold storage, and because the whole world now needs ultra cold storage freezers, ours are on back cold. So that is the only reason we have been administering Moderna. We're not here to say one's better than the other. We're just capable of storing Moderna. And then, really quick, I want to touch on AstraZeneca because it may be something that you hear about more in the coming month. On December 30th, the United Kingdom authorized AstraZeneca's COVID-19 vaccine, and the vaccine is built a bit different than mRNA vaccines, which we just talked about. AstraZeneca built their vaccine using a virus called adenovirus, and they genetically altered the virus so that it carried a gene from the coronavirus protein, which would theoretically then train a person's immune system to recognize the real coronavirus. At this time, it's not clear if they will take the formal step and apply to the FDA for emergency use authorization, but it could be a matter of time. So I just wanted to mention it. A big question we get with that is how it stacks up to Moderna and Pfizer. And when they submit for EUA, the FDA does weeks worth of review on the research from their trials, and then they put out a synopsis of that data. So once we get that synopsis, we can better stack them up and compare them next to each other and see where they stand. But at the moment, it's unclear if it's any better than the mRNA vaccines or any worse. So, um, but now we'll just move on to Cedric County Health Department's efforts. We've been planning for a vaccine since May of 2020, and we have been working closely with community partners and state organizations. We created an entire team designated for vaccine planning and distribution. Some things we were able to do pre-vaccine was put out a community survey that really just tried to shed light on concerns that our community has against this vaccine so that we could then begin to address those and kind of combat those problems. We were also able to put out another survey with community partners to help distinguish possible distribution sites to give vaccinations. We hold weekly updates with community partners. We hold weekly update with our local clinics. We hold weekly updates with a lot of people just to ensure that our efforts are aligned. It's a really large task to plan for a distribution of such magnitude. So we can't do it alone, and we just take it day by day here. But eventually the day did come, and on December 22nd, the health department received our first allotment of the vaccine, which was about 1,400 doses. And the county is currently following guidance from federal and state government as it develops and implements the COVID-19 vaccination schedule. So our initial distribution is currently geared towards healthcare personnel. We understand a lot of people want to be vaccinated and are in need of being vaccinated, but we do have to follow guidance from the state and federal government in terms of distribution. If we don't, we kind of just get the vaccine ripped away from us. So it's either we follow this or no one gets it. So our hands are really tied. That's a big issue we're coming into. The community, some members are upset, everyone wants it. So that's something we're also trying to combat, but we are sticking to that schedule because we have to. And The cedriccounty.org website on our vaccination page has an entire graph of availability or anticipated availability, and it'll show you where certain groups fall and where you may be about what timing you may be able to qualify for to get the vaccine. But I will say it's anticipated that by early spring we will be able to vaccinate all of Cedric County, all who want it. No, we're not forcing on anyone, but anyone who wants it, hopefully by early spring. That is what we are anticipating. Everyone in the general public will have access to it. So now about our clinic. The Cedric County Health Department is really proud to partner with our local community clinics. As you heard, we received 1,400 doses the first round, and that's really not a lot compared to how big Cedric County is. So we had local community clinics reallocate their allotments to us so that we could put on a mass clinic like we are currently at Interest Bank Arena. And the schedule is currently on the website. Some specifics on day 1, we did physicians and EMS. On day 2, we did registered nurses, physicians assistants, occupational, recreational, physical therapists, and so on. And we've continued with all healthcare associated workers ever since. Some logistics about the clinic is we're able to schedule about 20 people every 15 minutes. So we're vaccinating about 1,500 people a day. The process takes about roughly 30 minutes, with the majority of the time coming after your vaccination, because the CDC requires all who have been vaccinated to have a waiting period just to make sure they don't have allergic reaction. Some people may not know the ingredients and don't know if they're allergic to something. So we have paramedics on standby just to ensure safety. And that's kind of another big problem with vaccine distribution that I think the community doesn't realize is this isn't a vaccine that we could just hand over to Walmart and Dillon's because of that waiting period. You know, we're vaccinating hundreds of people within an hour. There has to be somewhere for them to sit and socially distance at the same time. So that's a big or misconception with the public, understanding why we don't just hand it over to fast-paced environments like that. But as I said before, this is a large task to roll out a distribution at this magnitude. So I was actually very excited when you guys reached out, because if volunteering is something you are interested in, we are glad to have you. The Cedric County Health Department houses a volunteer organization called Cedric County Medical Reserve Corps, and I will pass along the link to our website and the email to where you can reach out to say you're interested to Diane and Colin after this. So for those of you who are interested, you have access to it. Medical professionals who are able to give intramuscular injections are very needed, but also non-medical personnel as well. The clinic has so many roles. So if anyone is interested, we would greatly appreciate it. I spent much of last week out there myself, and I will say I lack any and all medical skills. So I myself found myself at the registration table, and it was a good place for me. So there is a shoe that fits all. And on average, it's like a 2 to 4 hour shift. Volunteers can choose in advance which days they want and can work. And again, just really quick, if volunteering is something you're interested in, the email is mrc@sedgwick.gov. But again, I will give that to Diane and Colin for you guys to reach out if that is something you're interested in. So I guess I don't know how long I took. I'm sorry if I took too long, but if anyone has any questions, I'm happy to answer any and all.
No, your timing was perfect, Amanda, and I think we are going to have some questions, which is why I'm glad you left some time here at the end for that. But I will just start it off in terms of a recent headline that we saw talking about how Kansas is the worst in the nation in terms of the vaccine rollout. What can you tell us to make us a little bit less concerned about that?
Yes, that was quite discouraging, especially because we're working so hard over here. But so there's actually just a lag and lack in reporting for Kansas. It's not to say that we aren't using the doses that have been allocated to us. And again, this is Cedric County. I can't speak to Johnson County or our surrounding counties, but the Cedric County Health Department is using what we have. We are pushing it out as fast as we can, as much as we can. 1,500 people a day is what we're aiming for. But that ranking is misleading in the sense that with the KDHE who oversees all of this, we are still working out the kinks to reporting how many people are being vaccinated a day. So that is where that last ranking is coming from. And hopefully that will change soon because that definitely, I'm sure, lit a fire in their butt to get it figured out really quick.
Very good. Thank you. Other questions?
Amanda, this is Deanne. I have a question around volunteering. If you're not someone who wants to be in a public place with other people and you've not been vaccinated, is there still a role for a volunteer to do something from home? Or is there a way to get vaccinated so you can show up and help?
I will have to seek clarification on that. I know that when we first started vaccinate or the vaccine clinic, the first day I was vaccinated because it was a big concern for our health director to have us working and interacting with 1,000 people a day and not being secured in that sense. So I will ask to see if that is kind of the route that we're taking with all volunteers. But I can't be for sure now. I don't want to go and offer vaccines and then not be able to back that up. So I will get clarification on that. But as far as working remote, I will say that the COVID-19 testing site and the vaccine clinic right now are the biggest focus. And I would assume those require mostly being there.
But yeah, part of what prompted my question was some of the article that Colin referenced mentioned that the reporting process that we know how to report into KDHE, but maybe not into the federal government.
Mm-hmm.
So if there was a way to address some of the technology issues remotely, that might be a volunteer opportunity for some of us who don't want to be in person without a vaccine.
Absolutely. And that is a lovely idea. I'm writing that down now. I will push that to our liaison and our health director because clearly we're lacking there. Anything else?
So, yeah, Amanda, I got a question. So I'm going to ask you to put on your marketing hat for the county.
Okay.
Um, obviously there's a lot of stuff out there. A lot of it's kind of all over the board. If someone wants to go out and search, they can find experts on both sides of anything.
Mm-hmm.
So there's a lot of misinformation out there also. Thinking through, the last 100 years since the last mass and the immunity systems and how they work. And a lot of people take care of their immunity systems and are very fortunate that they don't get sick as often. When I hear about the vaccines, I hear things like once you get the vaccine, you can go out, but it's only, and I say only, it's still better, 94, 95, 96% effective. So what, for those people that say, well, I've got a strong immune system and the vaccine's probably no better than my immune system if I'm taking care of it, what would be your maybe communication to them as to why it would be important for them to get a vaccine and what's the benefits overall to getting those vaccines?
So everyone would like to think they're invincible to this. Everyone doesn't really understand how it can affect someone and a family and an entire community until it happens. So I think the biggest answer to that is just trying to get them to understand the benefits of what happens with being vaccinated, regardless if it helps your immunity system. Um, there are advantages to just having a community that is vaccinated. For instance, the vaccine currently, there's not enough data to say if it stops the transmission, meaning it's not saying you won't get COVID-19. What the vaccines are preparing for is to kind of help the severity of cases. So what we're trying to do with these vaccines is our hospitals are filling up, our ICU beds are full. But if these vaccines are coming in and they're limiting the amount of people who would need to go to the hospital or need to be in an ICU bed, that is a win. And what people don't understand is that ICU beds filling up because of COVID affects them in many different ways. For instance, if they were to get in a car accident where they needed an ICU bed completely un-COVID related and they could possibly survive that accident, there's a chance that won't happen if there are no ICU beds available. So I say the answer to that is we have to try to explain to people that our hospitals being filled impact, and our healthcare workers, our frontline workers being exhausted impacts the community in more ways than just being infected or having COVID or getting sick or having a cough. So the vaccines are really in place to protect our hospitals and our frontline workers and to ensure that our community can is safe and covered if we were in a car accident that required me to need an ICU bed. So a lot of people want to rely on their immunity, and we see this a lot too with people who have already been infected. And while it's not common to get coronavirus twice, I will just put it out there, I have had it twice, and you can get it twice. So a lot of people think they're invincible, and I will tell you, I lived very excitedly of, I'm immune, I'm good, I survived. It came back to bite me in the butt very quickly because 4 months later, I sure enough had it again. And while it was less intense, it was still intense. So I think the idea that we're invincible really just needs to be combated with the fact that while it has much to do with coronavirus itself, this is impacting our world and our community at much greater lengths than we realize. And if we can just have people understand that the repercussions to having such high cases and our hospitals filled are much greater than simply being off work for 2 weeks. I think then that's when we can get people really to understand that the vaccines are another really great tool in our toolbox to fight the spread in our community.
I've got a question. At 1,500 doses a day, my calculator says we got about 500 days in order to inoculate the entire county. Are there plans in the future to be able to speed that 1,500 doses a day up?
Yes, so Cedric County Health Department will not be the only people vaccinating. So like right now, the hospitals are vaccinating their frontline workers. CVS and Walgreens are vaccinating long-term care facilities. As we continue to make our way through the distribution process and these groups that have been set in stone by the KDHE and the CDC, more people will be able to vaccinate. Vaccinating is not exclusive to the health department. As soon as we get out of this like healthcare personnel phase where we're trying to get our frontline workers done, it will be opened up for a wide range. Like currently, we have Grace Med and Hunter Health handing over their doses so that we are able to vaccinate more people. But more allotment is going to come, more vaccines could possibly be approved, manufacturing is going to speed up. So there are going to be more coming and there will be more people vaccinating. It will not just be Cedric County Health Department.
Yeah, I wonder if you might comment about the obviously there's been a hierarchy or a schedule of people. How do you find out what that is? Clearly, right at this point, it's important that we take care of the medical community. But some of the lesser priorities, how do you find out where you stand, and how is that going to work? For instance, for elderly people like me.
Yeah, so on the cedriccounty.org website, and I can again attach this in an email and get it to Colin and Diane so that they can disperse among you guys. I created a vaccine availability schedule for groups. And so what you'll see is it'll say something like late or winter, which is what we're in right now. And then it will have highlighted who is currently being vaccinated. And then it'll say early spring. And then it will highlight who will then fall into that group. And so along that is like schools and teachers, those with medical conditions, those amongst older age. So that graph on the website right now is the best way to find out where you might fall. And if you go to cedriccounty.org, it's the first thing, the biggest banner says vaccination. If you just click that, and it'll take you right to that graph, and it will be able to break down where you may fall.
So I see that Dave, you have your hand raised. Do you want to unmute and ask a question?
Yes, I was curious about has the second shot been started yet?
Not for the health department. We just started vaccinating last Monday. So we still have about 3 more weeks until we'll start administering that second dose. Pfizer requires 21 to 28 days. We're administering Moderna, so we have to wait that full 28 days, which is January 27th.
The other part of the question was, I understand there was reports out that criminals that are in jail may get a higher priority than some of the general public.
Interesting. I haven't specifically heard that from the timeline that we've received from the KDHE and the CDC, and per the graph, that graph is updated to as much as we know. Originally, when we first made the graph, it only said healthcare personnel, and we really weren't able to define who all that was because we lacked that guidance from state and federal government. But within time, we have gotten that guidance. So I went in and updated it to be very specific of who we've vaccinated so far. As of right now, they are not on the graph, and I don't know where they would fall. So I cannot speak to that, but I have not heard that on our end here.
Good to know. Thank you.
I think related to that, Amanda, I did hear last week that police and fire hadn't made the cut yet. Where do you think they will fall?
Yes, that was very disheartening for us, especially the fire men who are paramedics. We actually just got word after long conversations with the KDHE, we were able to add firefighters who are paramedics or certified to be able to fall into this group. But first responders are in the next group. So they will be very shortly.
Yeah, as you say, that was kind of disheartening to hear that, but it's good to know that you've got them on the list.
Yes, we're working very hard. We did not agree with that.
We do have time for one more question. Dave, did that take care of you?
Yes,
Okay.
I've got my her Cedric County website up on the other screen, so that's what I'm looking at.
Okay. Anybody else with one last question for Amanda?
And I have a last question if there's time.
Sure.
Amanda, I was wondering when it gets to the general populations or some larger groups, you've seen newsreels where people have lined up the night before and spent all night in their car, waiting to get in line for vaccines. For Sedgwick County, do you see a portal or some other way for people can schedule vaccination so that we don't have those long lines and all of that confusion? What's the plan to sort of organize, the general population groups?
Right now, for what we're doing, I think Tuesday was the biggest day that we had. I believe we had all 1,500 appointments scheduled. So we are going off of appointments right now. It is not just walk in. We're also taking the precautions to verify that they, right now are medical personnel. So the lines are going a little bit slower because with everyone that we see, we have to check medical license and things like that. But it is an appointment-based system right now. And I imagine that when we get to larger scales like the general public, we will switch up our logistics on how we want to do that. I know we talked about queue lists for a while in the planning team, kind of like what the DMV does when you go to re-register for your tags. It lets you know the wait time, things like that. So we're looking into things like that. But right now we are running based on appointments. So we're hoping, I'm sure we'll have something to combat those long lines. I can't imagine we'll have lines starting at midnight, as we're already going based off of appointments. So
Thank you.
Thank you for that, Jody. And thank you once again, Amanda. What a nice presentation. You covered a lot of ground. Any more thoughts you wanted to share before we let you get on with your day?
yeah, I just had somebody mention getting COVID twice, and how the vaccine symptom mimics our immune systems and what that will mean. Currently, because these were emergency use authorization, there is quite a bit of information that we don't know, how long we're protected for, things like that. So current research on these vaccines are still being done. They have not stopped. Currently, they're not even authorized for children, and that's being worked on right now, or pregnant women. And so research is continuing on those things. And hopefully we'll be able to find an answer on the longevity of the vaccine. We don't have a specific answer for that right now. The CDC doesn't have a specific answer for that right now, but hopefully as this research continues, that will hopefully be shed light on. So,
Thank you so much. Once again, great job. We greatly appreciate you being with us today.
yes, thank you so much for having me, guys. And I will get all that information to Colin and Diane.
Yeah, so we have been recording this and we appreciate your input. And so we will repurpose your messaging and put it up on our YouTube channel. We'll add the websites and some of those other data points, if you will. So thanks again for sharing so much information.
Yes, thank you guys so much. I hope you all have a great day.
You too.
Bye-bye.
And we are about to close up here, but we got a couple of minutes left for Deanne to, how do smiley faces have anything to do with the presentation we just saw, Deanne?
It might. Do you want me to do a very 2-minute show here?
That'd be perfect.
All right. Well, what I want to do is share with you a project that we've been working on for smiley faces. I went over to pick up my sister one day, and there in the yard of one of her neighbors were these little smiley faces. I thought those were so cute. And so we talked about potentially doing a project where we could put a rotary wheel on the other side of these and promote Rotary. As the Kansas Leadership Center started looking for opportunities for us to help promote the vaccine awareness, we thought we might then leverage this idea. So we are looking at taking a project here that started out simply as sharing smiles, and actually then leverage it to be a vaccine awareness project. So we've got a grant from the Kansas Leadership Center to actually buy these smiley faces for every club in our district. And so our club will be receiving a set of 10 round smiley signs and 2 rectangles. On one side of the rectangle, instead of "you've been sprinkled with smiles," which is what was in Sharon's neighbor's yard, it will say "vaccines," or maybe "vaccinations," we haven't decided that, "save lives." On the other side, it'll say "sharing smiles," which was the original thought. But during this next few months, as we put these smiley faces, all 10 of them, in different people's yards or at a hospital or at a project or wherever, we will put a smiley face on either sign of "the vaccine saves lives" and put a Rotary mask on those signs to draw attention to it and to encourage people to get a vaccine and wear their masks. So this is a project that we're getting ready to launch. I'll be buying these for every club in our district. District 5710, the northern part of Kansas, has agreed to participate, and so have the other 12 Rotary clubs in Kansas. So it is a statewide project now. So we need to step up to our part of that, have some fun with it, but bring a few smiles and maybe a little peace to people's neighborhoods. And so I'll be looking for someone. We really just need a couple of 2 or 3 people to help out. We need a point of contact here for our club that will simply store the 12 signs and keep track of where they are, so that anyone in the club could call and say, "I want to put the signs up here." Maybe Dr. Bob's, maybe Dr. Mike, maybe at the fire department, wherever you want to draw attention, and we want to move them around and have some fun with them. So we'll look for someone to do the coordinating of just the scheduling, and then people who are willing to move them around a little bit. So that's the idea behind the project. Should be pretty simple. And I would love for somebody to call me and say, I want to help. I've got a couple of people who have already said they would. I'm looking for just a couple more, particularly someone willing to put them in the yard. The ideal part of this project is during our COVID days, nobody has to touch anybody. You can stay 6 feet away from everybody else and simply open the garage door, let them come in and let them leave and bring them back. So that's the project, and thank you for letting me share that. I'd welcome any questions about it.
Well, thanks for nurturing the idea. It's been interesting to watch it progress from a feel-good to a saving lives initiative. So I think that's kind of cool to watch that develop. And since we do have our committee meetings next week, it'd be a great time to discuss whether or not one of our committees can shepherd this and keep it moving forward. But again, thanks for the effort to get us this far, Deanne.
Thank you.
Anything else from other members for the good of the order before we call it a day? Hearing none. Again, committee meetings next week. More information to follow. Have a very safe week. We will see you soon. Take care.